Hello again. I'm a research fellow at the Cleveland Clinic, Florida. I want to thank the chairman and SAGES for the opportunity to present this study. I have nothing to disclose. So as you know, hypertension increases the risk of heart disease and stroke, which are the leading causes of death in the United States. And about 75 million American adults have hypertension. This represents about 1/3 of the total adult population. And this costs to the healthcare system about $48 billion a year. So a brief resume of the physiopathology relationship between obesity and chronic kidney disease. We all know that obesity is favorable for a state of inflammation. So this is going to cause multiple metabolic disorders like insulin resistance, glucose intolerance, dyslipidemia, etc. Also, it has been associated with increased sympathetic nervous system activation. But more importantly for this particular study, through cytokines and GLP-1 activation, it increases the RAAS system, renin-angiotensin-aldosterone system, which increases sodium reabsorption and decreases afferent arterial resistance, causing the first sign of kidney injury, which is glomerular hyperfiltration, which if progresses can come up to kidney disease that makes it harder to treat hypertension and the vicious cycle starts. So there's evidence in medical literature suggesting that metabolic surgery is associated with reduction in high blood pressure and improvement in kidney function. So this is a very nice study by Dr. Shavian, the Gateway randomized clinical trial, in where he gathered a sample of patients with hypertension, which he defined as treated with 2 antihypertensive medication at top doses or 3 or more at medium doses. So in the, can I point here? So in the blue column on your right, he stratified in patients that had surgery versus the ones that did not. So in the blue column, you can see that patients that underwent surgery and had hypertension, almost 83% had a reduction of their antihypertensive treatment versus almost 13% in the patients that just stayed with intense medical therapy. And regarding the amount of medications, the patients that underwent bariatric surgery, Roux-en-Y gastric bypass, almost 25% had a total remission of need for antihypertensive medication. And as a secondary, very interesting finding, they were able to determine that the glomerular filtration rate had a significant improvement in these patients. So the aim of this study is to determine if the impact of bariatric surgery in the prevalence of hypertension in patients with chronic kidney disease. It's a retrospective cohort study where we analyze patients that underwent bariatric surgery at our institution between the years 2010 to 2017. And we use the American College of Cardiology guidelines to qualitative state which patients had hypertension or not. And we assess the kidney function with the estimated glomerular filtration rate from the chronic kidney disease epidemiological collaboration. So this is the chart from the American College of Cardiology. And this is a sample from the National Kidney Foundation calculator, which is a gold standard for obese patients because it takes into account the superficial body area. And in patients with stage 2 can be considered chronic kidney disease in these patients that have risk factors like obesity, hypertension, or proteinuria. So these are the demographics of our population. We were able to study 318 patients at the time of the surgery and after the surgery with kidney function and hypertension. These patients had a mean age of 53 years old, percentage of excess BMI loss of almost 30%. Most of the patients were female with 63%, and a slight more amount of LSG compared to Roux-en-Y. So an obvious decrease in BMI from 44 at time of surgery to 33 at 12 months follow-up, and a decrease in hypertension rate from 90% to 30%. So this is the hypertension prevalence in chronic kidney disease stage at time of the surgery versus 12-month follow-up. So patients that were in stage 2, well, all of the categories had a significant remission of hypertension, but most of the patients fell in the initial phases of chronic kidney disease, having a significant remission of hypertension. And when analyzing the chronic kidney disease stage per se, we noticed that in early stages like stage 2, more than 0.5% of the population regressed one stage at 12 months follow-up. Versus stage 3A, more than 60% had a regression. It means an improvement. And in stage 3B, more than 70% had an improvement in their kidney function. So the limitations of our study is that it's a retrospective study, and we have a loss of follow-up of about 30 to 40% of our patient population the first year after the surgery. And in conclusion, bariatric surgery reduces the prevalence of hypertension among all stages of chronic kidney disease. And a positive impact was observed in the classification of chronic kidney disease at 12 months follow-up. Thank you.